Too often in this broken system that we're trying to figure out a pathway forward in to create a revolution, which Jen, you've insisted is happening,
We're
that a
in it.
revolution. We're in it.
We're in it.
Yeah. I think that people are becoming way less tolerant of things that in the past I think they would have just, let flown by the wayside and, would not have allowed them. Somebody said that my mic is too low. Is that true?
I hear you. I hear
Okay.
you okay,
I just
but
want to
I
make
don't,
sure.
you know,
Always got to pay
whoever
attention.
said that, maybe it possibly be you. I mean, I'm very loud, so maybe you just, turn up your volume a little bit.
Yeah. That's, well,
Or they
that's,
say you're good. I mean, I hear you fine.
okay. So I bring this up because when Bernie Sanders ran for president the first time, I had never seen anybody really use a platform to talk about the importance of single payer healthcare in the United States at that level. No one had ever done it before. And
Nope.
well, in fact, no one had done it since JFK. No one had really used their platform in that regard. And so it became sort of a learning experience because so much of what the propaganda had insinuating was that, oh, America can't afford healthcare. That's not going to happen. We can't afford. No, we can't afford not to have healthcare. And so I went to, you guys remember about a month ago, a little over a month ago, I was sick. I had a bacterial infection and I needed to get medicine. And so I ended up going to one of the urgent care facilities that's close to where I live. And I do not have insurance. And so I paid the fee, which was $190. I mean, it's not pocket change by any stretch. However, a month later, I get another charge to my card, this time for $300. They charged me without my authorization. So my total financial responsibility for just going for a checkup to get medicine was almost $500. And it was about $550 when you factor in the medicine that I had to pay for as well. Most people cannot afford this. And this is just for a basic doctor visit. This isn't for a slip and fall. This isn't for surgery. This isn't for like a heart attack, something very serious. And yet, in my situation, I mean, this is off the charts insane what they think they can get away with. Now, Jen, being the lawyer here, insists that there's probably something written in the fine print that if they want to back charge you for something that they claim is something you either approved of or knowing that you went in there, you would be responsible for that. That was not the case. Usually the way it works is that if there's an additional charge for any service, they will typically send you a bill, and then you could either fight them on the bill, etc. They could put you into collections, etc. No, they actually charged me without my authorization. And having to fight this, I can imagine for somebody, for just any average person, is a nightmare that occurs all too often. And you can imagine, Jen, audience, how much of healthcare, or again, it's not healthcare, it's health, it's the health system, it's the for-profit health system that we live under. And so as a result, how much of it is actually bureaucracy? How much is it that they have these collection agencies? How much of it is these administrators that you have to get on the phone with to say, why are you charging me all of this extra money? What was it exactly, you might ask? Apparently, I wasn't informed that if I got a strep throat test or a COVID test, yeah, that's an additional heavy charge that you're going to get for it, even though I knew what it was that I had. But again, the doctor did not indicate that I would be charged extra for what I did. So this is just a prime example of how broken this system really is. And again, how many people go through this on a regular basis? And as Lee Argent says, we don't actually have free NHS healthcare. UK, we pay $20 per week national insurance. Again, $20 a week, $80 a month. I think most people would be agreeable to that, to have a universal system. And don't get me wrong, in the UK, it's been completely broken apart in many respects by the Tories. This has been their thing ever since Maggie Thatcher was the prime minister. So this is where we are. And I disputed the charge. We'll see what happens. But we can't live under a system like this anymore. This is absolute horseshit, and we cannot accept anything less than what is absolutely necessary for us to live, not to survive, but to thrive. We need a single payer system. I'm tired of getting angry about it. I'm tired of yelling about it. I know that the story that I just shared, and Angela, the lovely Angela here, who works in a doctor's office, says the health insurance companies are completely unnecessary. They are the for-profit middlemen in between us and our doctors. They have no reason to exist. Zero. I don't care how many jobs they created. They do not need to exist. The people that have those jobs, there will be an initiative to get them rehired in other positions. And if it's administrative, so be it. But in for-profit health, that doesn't need to exist. Do you know how much money, Jen, audience, do you know how much money this country would save if we had a single payer system based on the system we currently have? Do you know how much it is?
Somewhere about $10 trillion.
Well, that's over time. It's $500 billion a year. That's how much we would save.
All right, Henry, I just want to put this out there, guys. If you receive a jury summons in regular mail, meaning that it wasn't certified, meaning that you didn't have to sign for it, that means that it can't be proven that you actually received it, which means if you don't show up, they have no recourse. I've been doing this for years now. My dad's been doing this for years now. If they really need people, if they need to prove that you received something, then they need to send it certified mail. Just little tidbit of info for y'all. Save y'all some time. Anywho.
David Hunter is absolutely right. And look, New York City is one of the very few places in this country where you might have a chance at getting some decent health care. And that's very light, to say the least.
Hi, Leo.
I'm not familiar with that, Leo, to be honest, but I can look into it. If they're having a hard enough time passing it in Washington, in California,
Florida,
the best shot you got is New York. But if you're having trouble there, you can imagine how difficult it would be to try to get it done in the state of Florida. Because what you also have to remember about Florida is that it isn't so much that it's a deep South conservative state, it's that it's a billionaire's paradise. They move to Florida so that they don't have to pay anything. That's basically the point. They pick and choose what they want to give their money to. And giving money to the least of these so that they can have health care, well, you can imagine where on the pecking order something like that would end up for those types of people.
Yeah, it's not going to happen in Florida.
Nope.
I don't see how that would happen in Florida. The only way that there could ever be some sort of health care given in Florida would be completely private. People would be profiting. And somehow there would be that's the only way it would ever exist here. It would never exist here as a social good. And it's just, no.
And then again, I don't think we would be capable of breaking through all of the propaganda at the state level in Florida. Do I think Florida has the bandwidth to do a statewide healthcare system? Yeah, it probably does. But again, you're talking about a completely different type of wealth in this state compared to other states. Florida is one of the wealthiest states in the country, and it's also one of the poorest at the same time. So you try figuring that part out.
Exactly. Florida's way too greedy for that. And also Florida has, I believe Florida and I forget which other state have like the highest income inequality.
Yes, we do. They're right at
Our
the bottom.
income inequality is horrifying. Like we're one of the worst.
But is that really surprising though?
No, but that's so this is not that's not the kind of state that thinks that regular people are entitled to health care.